Hello everyone, I am Diksha Bharakshe.
I am Sahil Chawda.
We are interns from Vedic Dental College,
We are here to discuss about
Anchorage.
and space maintainer.
Now we will discuss about anchorage. In this topic, we will discuss about its definition, its sources and its classification. Now first we'll have a look on its definition which was given by Graeber. The nature and the degree of the resistance to displacement offered by an anatomic unit for the purpose of affecting the tooth movement. Now we will see the sources of for anchorage. Intraoral source and extraoral source. Intraoral source include teeth, alveolar bone, basal bone and musculature. In the teeth, the intraoral source for anchorage will depend on its root form, size of roots, number of roots, anatomic position of the teeth, axial inclination of the teeth and intercuspation of the teeth. Extraoral sources of anchorage. It is divided into cranium, facial bone and the back of the teeth. Cranium includes the occipital bone and the parietal bone. Facial bone includes the frontal bone and the mandibular symphysis. Now we'll see its classification, which was given by Moyers. It is divided into according to the manner of force of application, according to the jaw involved, according to the site of anchorage and according to the number of anchorage units. Now we will discuss it one by one. First we'll discuss about according to the manner of force of application. It is divided into simple anchorage, stationary anchorage and reciprocal anchorage. Now simple anchorage. The manner and the application of the force is such that it tends to change the axial inclination of the anchor of tooth or teeth in the plane of the space in which the force is being applied. Example is movement of the palatally placed tooth, as you can appreciate in the picture. Stationary anchorage. The manner of application of the force tends to displace the anchorage unit bodily in the plane of the space in which the force is being applied. Example, edgewise appliance. Reciprocal anchorage. The resistance offered by two malposed units when the dissipation of equal and opposite force tends to move each unit towards a more normal occlusion. Example, correction of a single tooth crossbite and midline diastema. Now we'll see according to the jaws involved. Intramaxillary anchorage. The resistant units are situated within the same jaw. Example is class 1 elastics. Intermaxillary anchorage. The units situated in one jaw are used to effect the tooth movement in the other jaw. Example, class 2 and class 3 elastics. Now we'll see according to the site of anchorage. Intraoral anchorage. Intraoral structures such as teeth and other anatomic areas are used as anchor units. Extraoral anchorage. Anchorage established from the extraoral structures are called as extraoral anchorage. Example, cervical and occipital head gas, forehead and chin marks. Muscular anchorage. Perioral musculature used as anchorage units. Example is limb bumper.
Into number of anchorage unit. Simple or primary anchorage, compound anchorage, reinforced anchorage. In simple or primary anchorage, the resistance provided by a single tooth with a greater alveolar support to move another tooth with a lesser alveolar support. Example, retraction of premolar using a molar tooth. Second one is the compound anchorage. More than one tooth with a greater anchorage potential are used to move teeth or the group of the teeth with the lesser support. Example, fixed mechanotherapy. Reinforced anchorage. When the teeth available for the simple anchorage are not sufficient in a number or in the size to resist the force necessary for the orthodontic treatment, more than one type of resistant unit are utilized. Example, anterior inclined plane.
Now we will discuss about temporary anchorage device. Temporary anchorage device is also called as mini implant, ortho implant, micro implant, mini screws, skeletal anchorage device or micro screws. Now what is temporary anchorage device? It is a device that is temporarily fixed to the bone for the purpose of enhancing the orthodontic anchorage, either by supporting the teeth of the reactive unit or by obviating the need of for the reactive unit altogether, which is subsequently removed after use. Now we'll see about its indications. It cannot afford any tooth movement of the reactive units. Several missing teeth making it difficult to engage the posterior units. For difficult tooth movements, that is, example, intrusion of the anterior and posterior segments and distalization, where there is asymmetrical tooth movement is needed. To treat borderline cases with non-extraction method. Doing extreme orthodontics when patient is not willing to undergo orthodontic surgery.
Now we will discuss about space maintainer, its definition and classification. Definition was given by Boucher. It is a fixed or removable appliances designed to preserve the space created by premature loss of primary tooth or a group of teeth. Now classification according to Hitchcock. Removable or fixed or semi-fixed, with a band or without band, functional or non-functional, active or passive, certain combination of the above.
Now we will discuss about Nance palatal arch space maintainer. It is bilateral, non-functional, passive and maxillary fixed appliance. Indications: maintains the maxillary first permanent molar positioning when there is bilateral permanent loss of primary teeth with no loss of space. Now we'll have a look on the video. Advantages: it stabilizes the arch. Disadvantages: it may cause tissue hyperplasia, irritation to the palatal tissues, pressure effects, and cannot be used in the patients allergic to the acrylic. Modification: modified Nance appliance for unilateral molar distalization. Now we will have a look on transpalatal arch space maintainer. Unilateral, non-functional, passive, maxillary fixed appliance. Indication: when one side of the arch is intact and several primary teeth on the other side are missing. When the primary molars are lost bilaterally. The appliance is designed to prevent the molars from rotation in arch expansion. Now we will have a look on the video. Advantages: it can be used in multiple unilateral tooth loss, can be used for expansion. Disadvantages: rotation of molars and both the molars may tip together.
Transpalatal arch with Nance button. Bilateral, non-functional, passive maxillary fixed appliance. Does not contact anterior teeth. Indication: provide anchorage during alignment and leveling, maintaining the maxillary first molar position. Bilateral, unilateral loss of primary teeth with no space loss. Create space in maxillary arch by distalizing molars. Contraindication: several teeth are missing, severe crowding, crossbite, erupting permanent teeth. Now advantages: prevent molar from rotation, arch expansion, habit breaking appliance, maintaining the position of the second molar when first molar have been extracted. Disadvantages: opening of bite due to molar buccal tipping, poor patient tolerance compared to standard transpalatal arch, food accumulation and soft tissue inflammation. Lower lingual bar. Bilateral, non-functional, passive, active mandibular fixed appliance. Indication: maintain the arch perimeter, prevent both mesial drifting and lingual movement of the molar teeth and lingual collapse of anterior teeth. Bilateral, unilateral loss of primary molars after the eruption of lower lateral incisor. Now we will see the video. Now advantages: many modifications are possible, can also be used to regain space. Arch holding space maintainer. Disadvantages: construction is difficult, more chances of distortion of appliance by tongue pressure, may cause unwanted movement. Modification: Hodge lingual arch with U loop used for space regaining. Removable lingual arch, omega bands in canine region to prevent interference.